I'm sure that's exactly how you feel when your kid spikes a fever in the middle of the night. Okay, let's be real. Parenting is not easy, but you are not alone. Welcome to the Parent Prescription, a podcast where I will give you real, practical advice to help you navigate the ups and the downs of raising healthy, happy children without losing your mind. Look, every parent has been there. It's late, your child doesn't look right, or something is off, and you're asking yourself, do I call the pediatrician? Do I go to the urgent care? Am I supposed to go to the ER? What am I supposed to do now? Today on the Parent Prescription, we are going to break down exactly how to respond and how pediatricians think about the decision so that you can feel more comfortable and confident in choosing the right place for your child to go when it matters the most, when they're sick. Okay? So, let's get into this dose of Dr. C. Okay. Hello, is this on? Okay, so at the beginning of this, I just want to do what I'm sure everybody feels like doing when this happens. Ah! I'm sure that's exactly how you feel when your kid spikes a fever in the middle of the night and you go, oh my gosh, why does this happen at 2 a.m.? Why? Why didn't you do this? You were running and playing and acting fine, and now you're burning up with fever. So the question is, what do I do? What do I do when this happens, right? And so I want you to ask yourself three things when your child is sick. Number one, is my child stable? Is she or he stable or is she unstable? Number two, is this time sensitive? Like, is this urgent, like emergent? I have to do something right now. Or is this something where I can call and I can wait just a second and regroup and do something about it after I get some information? And the third thing I want to ask is, whatever's going on with my kid right now, will this require special monitoring or equipment? If it's going to require special monitoring or equipment, it will help to direct your choice. Okay. Now, let me tell you, the main thing is the time when it's best to go to the pediatrician first. Okay. Either to call the pediatrician's office and see what to do, or to say, I'm just going to set up an appointment and go to my pediatrician's office. Let's go through a few of these scenarios. Okay. The first thing is fever. Any fever, if the child is over 2 months old, so they've already hit their 2-month birthday and they're running a 102 temperature, call your pediatrician's office. Set up an appointment. They will tell you what to do right then, or if you don't know the dose of Tylenol to give, they'll tell you what to do right then, and then they will set you up an appointment. Okay, so the first thing is fever, pediatrician's office. That is not an ER visit, that is not an urgent care visit. The next thing is like a chronic cough or a runny nose or a cold, or upper respiratory infection, and you say, I can't get rid of this cough, I can't get rid of this runny nose. That's a pediatrician's visit. A rash, that's a pediatrician's visit. Sore throat, earache, headache, pediatrician visit. These are visits to go to your pediatrician, okay? These are not reasons to go to the urgent care or to the ER, okay? Um, the reason it's best to go to your pediatrician's office instead of going to the ER or the urgent care when it's something that can be seen by the pediatrician, so it doesn't need special equipment, they are stable, they are just sick, ill, or hurting. Pediatrician's office, because your pediatrician knows your child. When you go to the urgent care or to the ER, you are going to see somebody new most times that you go. If you go often enough to see the same person, you are misusing your resources. You're misusing the ER. Okay? Please don't cheers and jeers me for that. That's me being honest with you. Okay? So, the main reason you're going to your pediatrician's office is because that's who sees your child. That's who knows your kiddo. Okay? They know what they look like when they're well, and when they're playful, they know what they look like when they're not feeling well and when they're sick, or if they're not as talkative as normal. They know your kid. Okay? The second reason that you're going to the pediatrician's office instead of one of the other two is because of it's cost effective. You are using your insurance Whether it's regular insurance, Medicare, Medicaid, whatever it is, you're using it the way you're supposed to be using it for the visit that it's supposed to be used for. And so that is the cost effective thing to do. Okay. And so they know your child is cost effective, and usually the wait time is not as bad when you go to your pediatrician's office versus the ER or urgent care. Okay. And so those things are just a short list, but those are the common things right now: vomiting, diarrhea, rashes, earaches, headaches, sore throat, coughing, possible flu. These are reasons to use your pediatrician's office instead of going elsewhere, even if it was in the middle of the night. Middle of the night, call first thing in the morning. Okay. Come back to the thoughts of what would my pediatrician say? Okay, hold on. Let me give you a dose of Tylenol, see if it responds. And some offices have a nurse line where you can call. And so you can call and get that help if you need to get through the night. But the idea is that you will go to your pediatrician's office for that visit. Okay. Urgent care. Urgent care. There's a lot of urgent cares going up. Anyway, when is it best to go to the urgent care versus going to your pediatrician's office? And so, cuts, like if we have a laceration or a cut where we were washing dishes, accidentally broke the glass, stuck our hand in there, and oh, now my child's hand is cut open. Here we go. That's not because you are going to have to wait at the pediatrician's office. That is something that an urgent care would be good at. If we think we broke a bone, if we go, why in the world did you just take your skateboard and try to use it and skateboard off the back of daddy's truck? And we think that we have a broken bone because we came in limping. Urgent care. They can do a quick x-ray. They can get you seen. They can take care of it. Those are reasons to go to an urgent care. If we are having wheezing or asthma-like symptoms, we're having bronchiolitis, or where we have a little one and we go, wait a minute, we're breathing funny. We're breathing a little bit fast and heavy. I feel like we're retracting or using our stomach muscles to help us breathe, and we're going really fast, or we're turning purple or blue around the lips and we're breathing fast, and we already have an inhaler or a nebulizer machine, but we tried to use it and it's not helping. Urgent care. Go to these places for those things. Possible broken bone or fracture, laceration or cuts that need quick stitching. Okay. Mild respiratory symptoms like light wheezing, or a persistent cough that you can hear a wheeze. It looks like we're breathing faster or harder. Those are good reasons to go to an urgent care so that you can get in a little bit faster, especially if it's in the middle of the night. Now, again, those things can also be handled in your pediatrician's office. However, if a child needs oxygen, if you go, yeah, but they look a little dusky and they're working really hard to breathe and they need oxygen, ideally you would go ahead and go to the urgent care or to the ER for that. Okay. Lacerations, usually suturing takes a little more time. So the pediatrician's going to say, if you were to call, if it's not able to be closed, if it's gaping open, if it's gushing blood, they're going to say, nope, go ahead and go to the urgent care or ER for that. Okay. Ideally, the urgent care. Now, then, Dr. Calloway, when do I go to the emergency room? If all of those things are reasons for me to come to you or go to the urgent care, what is appropriate to go to the ER? Okay, not much. Not much. Okay, yeah, I did that with a little attitude, didn't I? Not much, you guys. Emergency rooms are literally for emergency. I know it sounds cliche or simple, but the problem is that we're overusing our emergency rooms, and then we're getting upset about how we are getting treated in the emergency room. I hear it all the time. They didn't do anything for me. They did they didn't do anything for my baby. They just told me to follow up with you. It's like, because that wasn't the place that you were supposed to be. Okay? And so emergency rooms are used for emergencies. I'm going to give you some examples. If you get in a car accident, and you say, ooh, I need my child evaluated now. Emergency room. Okay? Emergency room. Okay? If you if your child has an obvious broken bone, meaning you can tell it's broken, it's coming through the skin, the bone is coming through the skin, you're going to the emergency room because that may require surgery. And so it's better to go instead of to an urgent care where they're going to have to send you, stabilize you, and send you to the ER anyway. It's better to just go to the emergency room. Okay? When you're talking about a baby under 2 months old, so if you have a 4-week old and you go, they haven't acted normal all day today, and then you check a temperature and it's 102, 103, and this baby's only 4 weeks old, emergency room. That's not an urgent care visit. That's an emergency room visit because they're going to have to get an x-ray and a urine, and they're going to have to get lab work. They're going to have to figure out what is going on with this 4-week old that they're running a true fever. A true fever is 100.4. 99 is not a true fever. 100.4 is a true fever. Okay, so that was just a side note. But a baby under 2 months old with a true fever, straight to the emergency room because that's something that could be very serious and it needs to be taken care of immediately. If they have to start IV antibiotics, they are needing to do that in the emergency room setting. Okay? Okay. You don't even have to call your pediatrician for that. You can call them on the way to the ER. Say, hey, Molly woke up with a fever. I know she's not 2 months old yet, so I wanted to let you know we were going to the ER, and your pediatrician will follow up with you to make sure Molly's doing okay. Okay? A serious head injury. You have a child that's a football player that was in the middle of a football game and had a really hard hit and went unconscious. Okay? That's an ER visit. A serious head injury. We had a fall from a bunk bed and hit our head and we went unconscious. We came back and we started vomiting. ER, emergency room visit. That's not a doctor's visit at the office. That's an emergency room visit. Okay? Which it does not necessarily mean that there's a head fracture. It just means we went unconscious, we woke up, we started vomiting. We probably need to get that seen in an emergency room setting. Okay? If we are having difficulty breathing, retractions, turning blue or purple, chronic cough, and cannot catch our breath. I'm not talking about in like a 30-second window and we did it twice in one day. I'm talking about literally cannot catch our breath, choking on something, and we literally are turning blue or purple. That's an ambulance call, by the way. These are reasons to go to the emergency room setting. Major trauma, um, excessive bleeding from somewhere after an injury or an accident. These are emergency room visits. Okay, and so emergency rooms may have longer wait times this time of year, but you still know that they're going to get the most emergent patients back faster. Okay. Urgent care visits, it depends on the time of year. It depends on which urgent care, what the wait times are. Even your pediatrician's office this time of year, the wait's going to be a little bit longer. However, they usually are able to get you in a decent amount of time to see you for the things that we said earlier that were minor. Okay. The reason for this information is because we hear complaints often about how we are treated in the emergency room setting or the urgent care setting, education that's given or not given when it's outside of the pediatrician's office. But ideally, your pediatrician is the one that's educating you and keeping you up to date and making sure that because you have that connection and that ongoing care for your child. And that's what your pediatrician is there for. Emergency room visits are for emergencies. They're going to be in and out. They're going to check what the emergency is and let you know how to treat that. And then everything else, they're going to tell you to follow up with your pediatrician. And so this should save you time, energy, effort, and frustrations if we try to stick with those first three questions we talked about. Is my child stable or unstable? Does this require special equipment or monitoring? And is this time sensitive? Okay, so time sensitive, special equipment or monitoring, Are they stable or unstable? And that will help you to direct your path on where you should go. Calling the pediatrician first if you are not able to get in and you say, yes, I know it's better for me to go to the pediatrician's office, but they're only open at this time and I have to work and my kid has school and I would rather do it in a phone conversation. Most offices can do televisits for you. You can do a televisit. But if you say because of an earache, how can they look at the ear over the telephone? Because of a rash, sometimes they'll allow you to send pictures of the rash and they're able to do it over a televisit. They can definitely answer questions over the telephone. The nurses are really good about talking to the doctor and getting the information and giving it back to you over the phone. That's not a problem if you just want some information given. But please do not use your urgent cares in your emergency rooms just for information or for questions that you have. That is what your pediatrician is for. Okay? So, to close this out, urgent cares, ERs, or pediatrician's office. When in doubt, call your pediatrician. Start there. Start at your pediatrician's office. Again, most of them have a nurse line that can help you with information or questions. They will tell you if you say what's going on, they'll tell you if they feel like it's a necessity for you to go straight to the ER instead of coming there for a visit. So when in doubt, start with your pediatrician's office. Ask those 3 questions that we talked about at first, and you're never wasting your pediatrician's time to come in. I have people to say, I'm sorry for wasting your time all of the time. You're not wasting my time. I actually prefer you to come in and say, I just really had a question about this. I don't know if he has an ear infection. He's pulling on his ears, but he's acting completely normal, but he keeps messing with it. And if there wasn't an ear infection, that wasn't a waste of time. You were able to find out if it was an ear infection or not, or if he just likes to play with his ears. You're never wasting our time as pediatricians. We want to work with you throughout the child's life to keep them healthy, whether that's questions or whether that's medications or whether that's anything holistic. However it is, we want to be a partner with you in the health of your child, and you're not wasting our time. But on the flip end of it, going to the urgent care or the ER for things that are not urgent or emergent can be considered a waste of time. Okay? So I hope that helps. Thank you for tuning in to the Parent Prescription. I hope you had a great new year. We're starting off 2026 right. And like, share, subscribe, all of those things.
Artlist.io.
Step by step, raise the whole room higher.